Ever wondered how anti-hypertensive drugs manage to keep the notorious silent killer, hypertension, at bay? Well, buckle up for a deep dive into the science behind these life-saving medications. Anti-hypertensive drugs, as the name hints, are medications designed to combat hypertension, more commonly known as high blood pressure. This condition, if left unchecked, can lead to severe complications including stroke, heart disease, and kidney failure. Now, onto the fascinating part. How do these drugs actually work? In essence, anti-hypertensive drugs are a classic case of divide and conquer. They target different aspects of the cardiovascular system to reduce the overall pressure. There are several types of these drugs, each with their unique mechanism of action. First off, we have diuretics, often the first line of defense against hypertension. These drugs increase the amount of salt and water that your kidneys expel from the body. As a result, there's less fluid flowing through your blood vessels, which reduces the pressure on the vessel walls. Next up are the beta blockers. These slow down the heart rate and reduce the force with which the heart muscle contracts. This means less blood is pumped through the vessels, which again lowers the blood pressure. Then we have ACE inhibitors and angiotensin II receptor blockers, which block the effects of a natural peptide that narrows blood vessels. By inhibiting this peptide, these drugs help the blood vessels relax and widen, making it easier for the blood to flow. Calcium channel blockers, on the other hand, prevent calcium from entering the smooth muscle cells of the heart and arteries. This helps the blood vessels relax and dilate, reducing the pressure within. And lastly, we have vasodilators, which directly relax the muscles in the walls of your blood vessels. This causes the vessels to widen, reducing the resistance to blood flow, and hence, the blood pressure. In a nutshell, anti-hypertensive drugs work by targeting different parts of the cardiovascular system to reduce blood pressure. Whether it's by increasing the amount of salt and water expelled from the body, slowing down the heart rate, blocking the effects of a peptide that narrows blood vessels, preventing calcium from entering heart and artery cells, or directly relaxing the muscles in the blood vessel walls, these drugs all aim to alleviate the pressure within the vessels. It's essential to understand that while these drugs are effective, they're not a cure for hypertension. They help manage the condition, but lifestyle changes like a healthy diet and regular exercise are crucial to keep hypertension at bay. So there you have it, a detailed look at how anti-hypertensive drugs work. Quite a feat of medical science, isn't it? Remember, knowledge is power, especially when it comes to your health. Stay informed, stay healthy.